Welcome to the NorthLakes Podcast. Today we talk to Ashlei Guarisco about dental outreach. She is a dental outreach manager and oversees the program in our eastern region. She'll be talking to me, Jeremy Oswald, and I'm a marketing and communications specialist working out of the city of Ashland. Let's meet Ashlei.
Thanks for having me today. My name is, like you said, Ashlei Guarisco. I am a dental outreach manager here at NorthLakes, and we oversee our dental outreach program across northern Wisconsin. And
you're in Lakewood?
Correct. Yes, I have an office in our Lakewood administrative building.
Which I'm up in Washburn and Ashland.
Okay.
So it's always nice to see someone from so far away. We've gotten large enough that, we've never met. So this is a great way for us to get together and get to know each other. And we met in the middle. We're at our Hurley clinic.
Yes. Beautiful Hurley.
Yes, exactly. And they're paving the parking lot today. So
I know, that's exciting.
So hopefully we won't hear any of that.
Yes.
So tell me about, we're going to talk about dental outreach. What do you do with the program?
So I oversee our dental outreach program is broken into two regions. We have an eastern and a western region, and I oversee all of our eastern. But we have teams of hygienists and assistants, and I help with the scheduling for them in our school programs, our daycare programs, our WIC office programs, and get them all set up for schedules and do our mobile dental program.
And WIC's women, infants and children?
Correct. So we go into county offices and do some of our treatments right in the county offices when families come into the WIC department.
Oh, I didn't know you guys worked with them.
Yeah.
But so that's kind of what you do. Sounds like you're one of the two coordinators of the whole program.
Yep.
But I've been around enough to kind of know about dental outreach. I think at one time it was called Seal a Smile.
Yes.
But now we call it dental outreach. And kind of in a nutshell, what is it?
So in a nutshell, it's pretty much dentistry on wheels. So we have all portable dental equipment, a lot of the same things you would see in a dental office, the chair that lays back, the chairs that the dentist sits in, the equipment that does the air, the water, except it's all portable. So our chairs fold up into bags, go in vans, trunks of cars. We have totes and carts where we just move all of our equipment from school to school. Again, like I said, daycares, Head Starts, and we offer preventative dental services right where the kids are versus parents having to bring them to us. So we go right in and see the kids and interact with them, do education with them, do fluoride treatments, we do sealants, we do pretty much sealants and fluoride.
And I'm still stuck on that. You fold up all this gear and put it in there. I guess I'm that kind of guy.
Yeah.
That I want to know about the gear.
We'll have to attach pictures.
Yes, right. So, but you're able, did we come up with this idea, or is this stuff exists and we just had to buy it, or?
So the stuff exists, and a lot of people haven't seen it, so it's kind of hard to picture. Seal a Smile as a whole has existed for quite some time. It's a state-run program. State of Wisconsin runs it. So there have been programs. I originally had started with Northern Health Center, so I've been doing Seal a Smile in our local area since 2011, and I believe that NorthLakes started theirs 2012 right after. So it has been in existence pre-2011, but it has definitely grown in our own region and many other regions since then, with Department of Health and Human Services being involved and Children's Health Alliance and Delta Dental. So with all of that extra backing, it has just really grown across the state.
So it's a kind of a state-run program that we administer for them, or we have some sort of relationship with the state that we do this?
We do grants through Children's Health Alliance and DHS to do this. We have to report our data to them, how many kids we see, statistics as far as how many kids have cavities and things like that, so that they have all that useful data, firsthand. These kids were actually seen. It's not an assumption or anything like that. So we work under them or for them to a certain extent and give them our data, and they give us grant funding as far as expanding programs and getting more of our portable equipment and things like that.
So, you go into the school and treat kids like they're going to the dentist, except the dentist goes to school. But it's not, I guess I shouldn't say dentist. It's dental care.
Correct. Our program, it's an amazing program. It's a great preventative program. It's an extra layer of protection for kids. But we always like to stress, we would love to be that dental home for kids, but we're not, we can't do x-rays in the schools and fillings and things like that. So we still are, one of our main goals is still to connect these kids and families to care. So it's a great extra thing, but we don't ever want to replace their regular visits to the dentist and getting that full comprehensive care in a dental setting as well.
And is it just a certain grade that you do, or is it all kids K through 12, or like what kids do you see?
So most all of our schools are, if they have early childhood or 4K preschool through 12th grade. So we see all grades. In our daycares, any child is eligible there as well. I mean, we have some that just had their first tooth at 6 months old, or, older kids that are there because school's closed today or something. So, I mean, we see a wide range of little kids to 17, 18 years old in high school ready to graduate. So any age in between is eligible to sign up in our schools.
And how does a school, how do you connect with a school?
So with the Children's Health Alliance and Department of Health and Human Services being involved, they keep lists of schools that are interested in services or need services, already have services. So if there is a school that reaches out, they will connect with us and say, this school is interested, can you reach out? A lot of our schools we approached when we started back in 2010 and 11 and just said, this is our program, this is what we want to do, is it something you're interested in? And majority of the schools in our rural areas are so happy to have somebody coming in and doing that preventative care, helping families find care. So it's kind of a mix of a school reaching out saying, hey, we want you to come and see us, or us reaching out and saying, hey, we have this availability of services. Would you be interested? So we have really good relationships with a lot of our schools. So every year, if we're not reaching out by July or August, they're reaching out saying, hey, are you, when are you coming? When are we getting forms? Uh-huh. So it's nice that way, so yeah, we actually see most of our schools in our regions already. Most of them are participating with us. So. And
our region's big.
It is. I think our dental outreach program sees, I think it's 23 counties, and I don't even remember the number of schools, to be honest. 23 counties, 264 schools in 75 districts.
Man.
So we cover, if you look at a map from the Minnesota border to the Michigan border and the lake border.
Well, there's 72 counties in Wisconsin, so we have a third of them.
Yep.
More or less. Mm-hmm. Okay, so it's like the top half of the state.
It is.
Quarter. Yep. Top third.
Our dental outreach program here at NorthLakes is actually the biggest See-less Smile program in the state of Wisconsin. Wow. So we see the most kids and cover the most area geographically.
Man. And how many people do we have? I'm throwing you for a loop here, it's several.
We do. So
several people we employ to do this.
Correct. So our teams, like I said earlier, consist of one hygienist and one dental assistant. And in my area in Lakewood, we have 3 teams, so we employ 6. And then there's also teams in Eau Claire. There's teams in Birchwood. To be honest, I don't even know where they're all based.
And that's just a testament of how big it is.
It is.
And I couldn't tell you either. I work in Ashland, and I know Jamie Cook. Yes. She's up there.
Yeah.
That's I hope she doesn't mind I'm using her name. But I know there's one based out of there. Yeah. And it seems like every pocket, every little, every NorthLakes clinic you go to, there's like a little room that that's the dental outreach folks, and they're not usually there in the day, but there's huge boxes of toothbrushes around, and it's like
exactly.
that's our
if
year
we're
supply.
Not there, our supplies are there.
Yeah. So you make this connection with the school, and then what happens?
So we make our connection, and there's the back end of administrative signing of agreements and things like that. We provide the schools with permission forms for all of their students. So they have the option, parents have the option of signing their children up on a old school permission form like they probably get for other things. Or there's actually an online consent form as well, a website they can log into, put their child information in, select their school, region, that kind of thing. So simply parents have to fill out that permission form. They do have the option of saying yes and no. It's not anything that they have to do because their school participates. So some parents say yes, some say no, send their permission form back to school. We collect them, gather all the information, make our list of kids, and then we schedule visits to come into the school. Most schools are 3 visits a year or per school year. And we try to come every 2 or 3 months. We schedule those with a contact at the school and get them in the calendar and then just roll on in with all of our stuff.
And so good to know, that kids aren't, this isn't mandatory or anything like that.
Right.
It's like parents definitely have a choice about
Definitely.
And so where do you set up? I'm envisioning you're in a gym or a school.
Every school is different.
Yeah. What? Where do you see?
We are on stages, where they hold their Christmas concerts. We are in conference rooms, supply rooms, like art supply rooms. Some schools are lucky enough to have an empty classroom that they use for activities like Seal a Smile and other things. So sometimes we have a full classroom too. We always tend to spread out when we have a lot of room because we sometimes have very little room. But every school is different. Some, like you said, some have a gym that they don't use if they have a big gym, a small gym. So it's really versatile that way. I mean, if you have a conference room, a classroom, some sort of empty space that can fit a dental chair and air compressor and things like that, we typically can make it work.
Wow. So I know it's not a tour bus, but I'm just envisioning like a band on tour, but it
feels like it when we haul everything in.
Yeah. So you wheel up, load up, set this up, and then there's just a line of kids out the door and the nice thing about being in the school is we do our best to work around school schedule. So if, the first graders have something really important they need to do in the morning, we'll go to a second grade classroom. But we have our list that we compile from the permission forms that we collect. We go right to their classroom, take a couple students at a time, and then, one is in the chair and we see them and one will wait outside the door or something like that. And the flow, a lot of schools, they always kind of laugh and say, we don't even know you're here. We sign you in the morning and it's like you do your thing and you're gone at the end of the day. We tend to try to make it very easy on the school that we don't, we're not an extra thing on their plate today or a thorn in their side while we're there. So we just kind of filter through kids depending on when they're available and, work around lunches and all that kind of stuff. So we just go and get the kids we need, and it's nice seeing all the grades because most of the time they recognize us now. Oh, the dental team is here. Or, are you seeing me today? It's like we're celebrities. Can I come in now? It's not your turn yet. We'll have to wait. But anything to get out of the classroom. Huh?
As they get older, that's like the selling point. They're, oh, well, if I can get out of class 3 times this year.
And I mean, I don't feel this way. I always enjoy going to the dentist, but there are some people that have apprehensions about it.
Yes.
Sometimes kids do.
Yes.
And sounds like you don't have that.
We really don't. A lot of people ask, is it hard working with kids all day? Behavior or not wanting to do it. And majority of the children are very compliant. They're excited to come in. They've seen their friends leave the classroom and have a turn. They've seen their friends come back with a new toothbrush or, them chatting about whatever was happening. And it's not as scary, I feel like, when it's in a comfortable setting. It's a school they know. There's only a couple of us there. It's not a full staff and the noises that happen in a regular dental office. So it's kind of nice for those kids, especially that are scared of doing it or haven't done it before, just to kind of get that gentle introduction to, this is what we do. Show them the stuff we have. And it's pretty simple, painless procedures. It's quick. So if they haven't done it before, it's a good first experience. If they have done it before and they've been scared, it's, like I said, it's painless. So it's nice to get them that good experience that maybe can counteract some of the bad experience that they've had in the past.
There isn't that stigma about the dentist.
Right, exactly. Because they're, in another classroom in their school. They're in their comfortable space. So,
wow. And so what do you do then? So kid comes in and let's say that they're in there for the first time. What is it? What do you do?
when it's just them, and two of us, it's pretty, low key, how's your day going? Try to make that good relationship, make them feel comfortable. We're here to count your teeth. We keep it, pretty simple. We count teeth. We have tooth counters and, tooth mirrors so we can see. So we talk a little bit about what they're doing at home. Are they brushing? Are they flossing? Talk about healthy foods and snacks and drinks and things like that. Kind of get that one-on-one time education-wise that some kids may or may not know. Go through that. And then we lay our chair back like you would in the dentist, count teeth, and, chat with them the whole time. It's kind of nice. We're not really we have a certain number of kids to see, but we're not on a set schedule. So if someone's apprehensive and it takes a few extra minutes, it's really no big deal. We can show them our instruments and tools that we use. And, we can show them how the compressor squirts water or how the straw works.
You don't have that here, do you?
No.
Oh, okay.
No, you're safe today.
Okay. Well, if you were showing it off, I might be interested. Anyway, and so that's how you kind of make them feel comfortable. Mm-hmm. What are you actually doing? You're not just counting teeth.
No. Oh. And we do count the teeth.
That's a good idea, right?
I shouldn't say we don't do it.
Right,
we do. Right. So we obviously have, again, our, dental record and things that we have to chart, if they have an area that looks suspicious that, we should probably have a dentist check out. Maybe it's a cavity. We're looking to see if they have any signs of any possible abscess infections or stuff like that, anything that would warrant an actual dental visit at an office where they need some x-rays and things like that. We check to see if they have any loose teeth. Kids are very into when they have wiggly teeth, so we'll check that, check for any new teeth coming in and things like that. So our fun tooth counting is actually what we call a dental screening exam. So we're checking everything over, making sure there's nothing that would warrant that referral to a dental office and things like that. So, and then at the end of that, we'll usually brush on their fluoride varnish, which again is, we show it to them. It's like a little paintbrush for teeth, we always call it. Do their fluoride and on they go.
And if there is, let's say you do find something that warrants further care, what happens then?
So we call it a dental referral form, and it's actually a triplicate copy. So if a child is identified as having some sort of dental need, we fill out this form, their name, birth date, what we saw that looks suspicious. We can circle a tooth that would say possible cavity and things like that. We keep a copy of it, and then we also send a copy of it home with the child. So every time we see a child, any child gets a note of just knowing what we did. We always want the parents to know what was done that day. So they'll get that plus this referral form. That way the parent is aware that something suspicious was noted. And then our program is really good at our case management piece. So the copy that we keep of that referral form, our dental hygienist, when they get back in the office, will call the parent or the guardian that signed the permission form, let them know, we saw Susie today. It looks like she might have a cavity. Do you have a dentist that can check it out? And depending on their answer, if they do, great, we would recommend making an appointment with them. If they don't, that's where our team comes in to, what insurance do you have? We don't have insurance. Do you need help paying? We, can talk about sliding fee at NorthLakes. We can, if they have Medicaid, we take Medicaid and things like that. So our case management, obviously our school part is important. Seeing the kids is important. But another really important piece is that case management and getting those families connected with care if they have some sort of barrier to getting there, barrier to paying. If they're not really sure where to go or who takes their insurance, we talk them through that, get them information on where they can go and things like that. So some kids don't get their notes home. So we call parents
Really?
And they're like, no, I didn't get that note. So they're really thankful to get those calls, just a kind of a heads up to follow up and things like that. So we always notify the parents everything that we do and then let them know if there's anything further that should be done.
And is there you did talk earlier that there's a way for parents to sign the permission slip virtually, do it online?
Yep.
Is there a virtual way that parents can check on that appointment as well?
No, everything as far as what we send home is all paper copy.
Right.
So the kids will get it in their folder. Once they send that electronic permission form through, it'll notify our dental outreach managers that it was filled out. But after that, the parents don't see anything electronically. They would just look for the communication coming home with the kids or the phone call from the hygienist if there's a concern.
So there's a follow-up.
Yep. Yeah, so they know when it happens. Sometimes assuming that the kid takes the form home.
Right. Yeah. Well, we were all there once, right?
We were.
And so then 2 or 3 months later, you come back? Mm-hmm. And tell me a little, I don't know what the fluoride treatment is. What is that? Okay. Did I just say that right? Is that what it is?
You got it.
Can you talk a little bit more about what that is? And what is it?
There's a few different ways that dental offices put fluoride on. We do what we call a fluoride varnish. The nice thing about it, one, it's really easy. We simply it literally looks like a small, like watercolor paintbrush. Fluoride or the fluoride varnish is kind of like a thicker toothpaste. We put it on this brush, simply paint it on the teeth. So the kids think it's fun. We're painting teeth. And that fluoride varnish is there to help strengthen the teeth, help prevent cavities. If any teeth are maybe a little bit weak already because of lack of brushing or something at some point, it'll help strengthen up those weaker parts of the tooth. So just a nice extra preventative layer of protection to help keep all these teeth healthy, whether they're baby teeth, adult teeth, or any of them. So we paint it on. The teeth don't really look any different. It's white like teeth. You sometimes can kind of see a little bit of it on, but the nice thing is it will brush off. And the nice thing with this varnish too is kids can eat and drink. That was kind of every kid's concern. Can I eat? Snack is in 25 minutes. So kids can eat and drink after these fluoride varnish applications. The only thing we ever ask is like nothing super sticky. So don't eat, fruit snacks afterwards or chew on bubble gum or stuff like that. So their day can go on as normal after the application of it.
You're not passing out caramel after
No caramels.
I hate to just do like a generalization, but like what are the kids usually coming in? I mean, you must see like perfect teeth, although like the whole spectrum.
We do. Some kids, come in and, their teeth are clean, shiny, you can tell, they've been to the dentist, they've had dental care, maybe they already have sealants on some of their teeth and things like that. And then we also see the other end of the spectrum where they, need that referral or have signs of infection and things like that. So it's kind of a fun thing about dental outreach. Some days you never really know what your day is going to look like because every day is different kids, different ages and things like that. So you never know what you're going to see or what you're going to hear from kids. So yeah, you can see anything across the whole spectrum.
And I guess I just shouldn't say, well, this is an obvious question, but why is it important to take care of teeth?
It is for a lot of reasons. And some of the obvious ones, teeth are important for chewing your food and your smile and talking and things like that. One thing we run into a lot because we see a lot of young kids is taking care of baby teeth. Well, they're just baby teeth kind of conversation. And all of our teeth are important for holding space. So if a baby tooth has a cavity and has to be removed, that tooth is important for holding the space for the adult tooth that has to grow in its place. And if that tooth is removed too early, other teeth can shift and then the adult teeth can have trouble growing in. So losing baby teeth too early can affect the growing in of the adult. So you could be looking at braces. You could be, looking at those kind of things. And just having cavities in your mouth is, having bacteria and things like that. So having cavities on any of your teeth put the rest of them at risk because you have that bacteria in your mouth. So it's important for your mouth. It's important for your overall health too. Your mouth connects to the rest of your body. So if you have infection issues and such in your mouth, it can affect your overall health as well. So it's an important part of overall health.
Okay, I'll brush.
Thank you. Sold.
Yeah. And it's, as you said, it's not just once a year thing. You're there like two or three times a school year.
Yep.
So if a kid misses, they're absent that day, there's going to be another opportunity.
Yes. Yep. There is. And if they're, absent, we make note of it in their chart. We make sure they still get their toothbrush and things like that. We'll leave it with the teacher or bring it back the next time. But that is a nice thing about it. So if, somebody's out sick or somebody's on vacation or something at one of the visits, chances are, we're going to have 2 more chances to catch up with them throughout the school year.
Fantastic. So have parents, are they any that are like a little leery of the program, or what are some parents' concerns that you could answer right now? If there are, maybe they're not.
There are some. And some parents are concerned, well, we already go to the dentist. Should we do this? And our answer always to them, it's a preventative measure. We never, like we said before, we're not a dental home. We don't want to take them from their dentist. We want them to continue that care. So it's definitely, we would tell them it's just another layer of protection for their teeth, another chance for them to talk about taking care of their teeth, another oral health education time. And so we always talk about things like that. Another parent concern is, they go to the dentist and they just had fluoride. And parents have the option of opting in or out of that. We have parents that'll write on the top, no fluoride, please, which totally fine. We make a note in our chart and on our schedules that those kids don't need fluoride or just had it. So if there's a concern as far as receiving fluoride, parents are welcome to just write a note on the permission form, or there's a notes box on the virtual permission form as well, where they can indicate, no fluoride, please. So if a concern is, receiving that, parents are welcome to make the note. Parents sometimes worry too, like if our program is completely free. So I think some parents are kind of, is it really free? Is there really, so some parents will ask that, is there a charge? Is something going to pop up later? And it's, no, it's completely free of charge to the family, free of charge to the school, so those are some of the concerns that we run across. And our numbers are on our forms too. So if parents ever have a question or concern, they're always welcome to call or email too if they ever have a question.
So there may be an expense down the road if you were to find something that they needed a further referral. It wouldn't be through this program. Correct, it would be with that.
Right. If they have, a possible cavity that needs a filling or something, then at that point, that's between them and the dental provider and things like that. But us coming in, doing the school visits, doing the fluoride applications, doing the sealants, no charge to schools or families.
Great. And that's from the state of Wisconsin? That's where that funding comes from?
Yep.
Neat.
We are able to bill Forward Health, Badger Care, Medicaid, whichever you prefer to call it. So if a child is covered by that program, we can bill that. But if somebody has private insurance or no insurance, there's no, extra bill going to them because we have nothing to bill. So there's no bills that ever go out to the families when the school visits happen.
And it sounds like if there are any questions at all, you're there. There's a phone number.
Yep.
And on that virtual permission slip, I'm going to guess that there's a way to contact you as well if there's questions.
Yep. And we have really good relationships with all of our schools as well. So if parents had a question or wondered how to get in contact, if they get in touch with their school too, all the schools know how to get in touch with us and, can always get us information and stuff as well. So there's quite a few avenues if anybody ever needed to get through to us for a question. We're available in those ways.
You answered all my calls very promptly.
Good. I try.
Yeah. I guess they were emails. But. And and here's another, I'm going to admit that Ashlei and I did talk a little bit before about what we were going to talk about. And
I like to be prepared.
Yes. So sorry, here's a question I didn't prepare you for.
Okay.
Homeschooling, is there an option for people who homeschool their kids? Or if are maybe at a school that doesn't participate to somehow get involved in the program? We
have had, especially with COVID, we've had some families that are homeschooling became more prevalent, I guess, during COVID. In some of our schools, most of our schools sent forms on to those families as well. And those families had the option of bringing their kids in. Like, we would kind of schedule a time, like Wednesday morning from 8 to 9 if you want to bring your child in for this program, and then they could bring them in. So schools are really good at communicating a lot of that with any of their homeschooled families. Again, they have the option whether they want to sign up and bring them in or not. And the 3 visits is still offered to them as well. We have never really run into an incident where there's a kid at a school that doesn't have a program but wants to be seen. We have had, parents that are interested in the program and then go to their school board or a principal or administrator and say, hey, ABC school is doing this. Can we do this too? And, they've contacted us and said, is that something we can add on? And then, again, we go and have the conversation, let them know what we do, and go on from there. So homeschooled children do have that option. And if parents don't see a form, again, they can get in touch with the school nurses or school secretaries, and they all have permission forms and information about our dates. So if there is a family, I would always encourage them just to touch base with their school, and they can get them the information.
Okay, so if someone, let's say, is listening to this and their school doesn't participate, is there a website or something that they could look up, or how would they maybe make a connection?
So there is, our NorthLakes Community Clinic website does have a dental outreach tab.
NLCCWI.org.
Put that little plug in
yes,
there.
Exactly.
So they can go on there. There's the dental outreach page in there that has our phone number and our email address that way. So they can always get right in touch with us. There is also a website for the program as a whole through Children's Health Alliance of Wisconsin. They have a See a Smile page that talks about it statewide, like the contacts at the state for school participation and who is funded through them and things like that. So, broadly for the whole state, they could always go to Children's Health Alliance of Wisconsin or check out our NorthLakes information to get in touch.
And is it wrong for me to assume that most schools are already participating?
No, most, and I don't want to give any wrong information, but majority of our schools in our regions are participating in some way, shape, or form.
Okay.
And there are a couple. We have over the years we've kind of slowly started expanding with private schools and things like that as well. So there is definitely some room for expansion, but pretty much all of our public schools, daycares and those kind of things are all already having services. So, if somebody isn't aware, check with your school. We might be there, and maybe permission forms aren't getting home or, things like that. So,
yeah. Okay. And, I don't know, here's a little bit of my story that you don't necessarily need to hear, but it's part of this question. So I used to, in one of my roles here at NorthLakes, I used to be really involved in HIPAA.
Okay.
So how do you deal with that in this program? And HIPAA's the program, it's the just patient privacy. General, how do you deal with the patient privacy?
So our permission forms, like we said, they do get collected typically by the school, and then we collect those forms and we make essentially a spreadsheet of the kids that we have to see. We don't like to carry the full permission forms with names and addresses and all that information. So we kind of get all of that information put into our electronic dental records before we go to the school. That way everything is secured in an electronic, an official electronic dental record. That way we don't have, the chance of dropping papers, losing papers, things like that. So everything, is kept that way. We use just our list of kids versus having all those forms. When kids come in and see us, we have just them in our chair, so other kids aren't, leaving and saying, oh, hey, they told Johnny he had a cavity, so within the school, we do, keep an eye on that as well. So there isn't a bunch of kids listening in that way. And then as far as case management wise, we have names of whoever signed the form. So parent, guardian. So we always, if we're calling, we always verify, is this child's mom or dad or, that kind of thing. So everything is pretty much kept, within our electronic dental records. There's conversations just between that parent and us. If the person on the phone identifies that they're not on the form, then, we leave a message or call back again. So that way everything's pretty secure.
So all the stuff you do in the clinic.
Yep.
Yeah. Of course, I don't. That's funny that I ask a HIPAA question, but I guess that is, we're trying to do this so parents know more about the program, but they should rest assured that everyone's privacy is well taken care of.
Yep. And we have our spreadsheets that we take to the schools. We carry them all in locked bank bags. So they're key access that just the hygienist and the assistant can access. So everything, even in transport, is secured that, if something were to, no papers or lists are going to blow out the window on our drive kind of thing. Okay. So nice. Everything's secured.
And so that's kind of the school part of the program, but is dental outreach more than that? It's not just schools, right?
No. So we also go to daycares and Head Starts, and they run pretty similar there as well. So same, permission forms go out and come back, and we offer the same services there. So we do a lot of our local daycares, Head Start programs, and then I'd mentioned earlier the WIC offices as well. And their WIC offices are always kind of nice because the parent is there too. So we can always, reiterate home care and things like that. So in the daycare and the WIC setting, we don't offer sealants, but we do the fluoride and the education and things like that. Kids still get their toothbrush and those sort of things. So pretty much runs the same way. We have a little bit less equipment in those settings just because we don't need air compressors or water and things like that. So, that's even a little bit more comfortable. If kids are nervous, we have them, sit in a daycare chair next to us and, we sit on the floor and count their teeth or whatever is comfortable for the littles when they're that small. But yeah, it pretty much runs the same exact way. Permission form, we make a list, come back, hang out with the kids for a little while, and
everyone has beautiful teeth.
Yes, we try. We try.
And nursing homes, do you go there as well?
We do have some programs that go into nursing homes as well. And those programs, they actually take a dentist with as well. They're able to do some basic restorative care, fillings and things like that right on site. Many of our nursing home patients, it's difficult for them to travel. It's difficult for them to get into the clinic and things like that. So we bring that basic care to them. If they need a referral or have some sort of bigger issue, then we can take care of in that setting. We'll work on finding where we can get them, how we can get them there. But then we actually have a dentist so they can do that restorative or small filling care right on site.
And that's the same program. You'll still take that mobile equipment in and
Yep. That equipment is a little bit bigger just because we have handpiece drills and things like that. But yeah, it's pretty much the same. We come in with bags and we build chairs and
I gotta come see it sometime. I really, check it out. I want to.
It is. It's a lot of people in a lot of schools when we were new said the same thing. What is this going to look like when you make my school a dental office?
Right. And so what do you do with the trash? I'm a silly question, but I mean, I'm like, what do you like?
So all of the stuff, or all of the, the mirrors and our tooth counters that we use, everything is disposable. So we don't have anything, we don't have to worry about autoclave sterilization, that kind of stuff. Most all of our garbage is, paper type product, like napkin, gets tossed in the garbage. We don't do anything bloody, so we don't ever have to worry biohazard wise. So, plastic chair covers go in the garbage, napkins go in the garbage, our mirrors go in the garbage because they're disposable. And we have our tooth counter does have a metal tip, so we take a sharps container just to toss them in. But otherwise, at the end of our day, we tie our garbage up. The school staff, custodians, usually it disappears out of our room at some point at night, and we make them another bag of trash the next day. So yeah, it all just gets tossed.
Wow. What are some other things? What am I missing? It seems like those are the kind of the obvious questions.
Yes. I don't think we talked about what sealants are. That's one thing that parents a lot of times ask.
And here's like, that's my bias. Like I just thought fluoride.
No, it's two different things.
What's a sealant?
So we mentioned the fluoride varnish earlier, and we do that at all 3 of our school visits. So the children are eligible for 3 visits or 3 fluoride applications through the year. And then at one of those 3 visits, we also offer dental sealants. And when we explain it to the kids, because kids, they don't know what that is, we always tell them it's like a special covering on their back teeth that fill in the grooves or the wrinkles of the tooth. So it's a sealant is white like teeth. It's not like a silver filling or anything like that. Many people don't even see them because they're tooth colored. And the sealant's job essentially is to be a coating to fill in those grooves of the back teeth. Those grooves are really small, and they have microscopic pictures that toothbrush bristles don't fit in those grooves. So a lot of cavities on back teeth start on those chewing surfaces. So essentially it just kind of fills those grooves in with this tooth-colored sealant. So less bacteria and less germs stick, which mean less chances for cavities.
So it's like a porch, like a varnish.
Kind of, yeah.
Like it just like covers it to protect it.
Yep, so it fills in those grooves. Great thing, it's completely painless. There's no needles, there's no drills. We pretty much, we clean the tooth off with a toothbrush, have to keep the tooth dry, paint it on, and that's it. So it's not numbing, it's not drilling, we're not removing any tooth surface. So it's just another extra preventative layer to preventing cavities on those back teeth. Some dentists do them on baby teeth, but our program is geared towards just on the adult molars. So once they start hitting, 4, 5, 6 years old, they probably have some of those molars that we can do sealants on. Tell
me, how did you get, what made you get involved with this? You said you've been doing it for a long time.
I have.
You must really like it.
I do. This will be my 11th year doing this program. And I kind of laugh when people ask me that question, because back in 2011, when I took this position, I was just going to do it till I found something else. So
still looking.
I'm not looking. I love doing this program. I didn't really think it was what I would want to do, hauling heavy equipment and, seeing kids all the time. But hauling the equipment with the carts and the wheels really isn't that big of a deal. And I just love doing it, seeing the kids. Now that we've seen them for so many years, they recognize you, and, we recognize them, and they tell us about new brothers and sisters and what they did over the summer. So I love doing it, and I'm glad that I haven't ever found anything better than dental outreach, because it's just so fun and rewarding to see the kids and talk to families, and they're thankful that they had help finding care or breaking down those barriers that they needed. And it's a very rewarding program to be part of.
Awesome.
I love it.
And what, in that 10 years or so that you've been doing it, has there been any big, I'm going to go back to the gear, any technical changes that made the job easier, or?
Yes. So when I first started, I was actually with Northern Health Centers. So,
which was that? And that was out of Lakewood?
Lakewood, yep.
And that's what we merged together?
Correct.
Okay.
Correct. So when we merged with NorthLakes, I continued on with the program, which has been great because we were able to grow the program. We used to not be able to see all grades, just staffing wise. So now we can offer it to more. So, the size of the program in our area has grown tremendously since, I only saw 2nd and 6th grade in 2 counties when I first started, and now I'm seeing all grades and, I think it's 7 counties in my immediate region. So it definitely has grown. Some of the processes obviously changed with mergers and things like that, but with having dental assistants and having Children's Health Alliance and Department of Health and Human Services on board, it's really not too difficult on the back end. We have an assistant to help. They have a state-run program where we put our data in that at the state level built for us to put all that data in, so we don't have to, do spreadsheet style data collection wise. So yeah, there hasn't really been too much shift as far as how we do things. Just the size of what we do has changed a lot since my first time.
Nice. And how often do you brush your teeth?
Twice a day.
Yes. And
morning
floss?
And I do every night. I floss.
Yeah. Feels good, doesn't it?
It does.
You
it
never.
Does. Once in a great while.
Never mind. We don't need them.
We won't go into detail about that.
Right. I just can't get out. So I have one last question for you. What's in your car?
Right now? Mm-hmm. Well, right now I have the work van, and it is filled with probably 10 portable dental chairs and 46 boxes of permission forms that we have to get out to all of our schools in the next couple weeks. So permission forms and dental equipment.
Right. Okay. What about your own car at home?
My own car has a car seat for my toddler. I have a 4-year-old at home. So his car seat is in there, and who knows what snacks are probably buried underneath it. And, the usual umbrella and extra change of toddler clothes and things like that. Nothing really exciting.
Okay. No, that is exciting. Ashlei Guarisco, thank you so much for doing this. It's been a pleasure talking to you.
Awesome. Thanks for having me. I hope this gets some more information out about our program and hopefully answers anybody's questions that we have. And like we said, can always get in touch if there's further questions.
Excellent. Well, thanks again, and have a good ride home.
Thanks. You too.
And if you're ever up, stop and see us in Ashland sometime.
I'll have to do that. I haven't been up to Ashland yet, so I'll have to make it a point.
I know. It's like we're so far away.
I know.
So, and it's not
like a whole nother world.
It is. Yeah. So thank you very much.
Awesome. Thank you.
Okay. Thanks, Ashlei. I've always wanted to know more about how dental outreach does what it does, and now I just need to go see firsthand how those chairs get set up. NorthLakes Community Clinic is located in 13 locations throughout the northern third of Wisconsin. We provide a wide variety of services to people of all ages and see them regardless of their ability to pay, be it private insurance, no insurance, Medicaid, or Medicare. Call us for more details at 888-834-4551. I'm Jeremy Oswald, today's host for the NorthLakes Podcast, and I'm in the marketing department. Subscribe to our podcast and leave us a message telling us what's in your car, and let a friend know about what you've heard. We'd be very grateful. We have a vibrant website with lots of information, including how to schedule an appointment, pictures of all our providers, what services we offer, and where our clinics are located. That web address is nlccwi.org. nlccwi.org. Thanks for listening to the NorthLakes Podcast. We really appreciate your time and hope you have a great day.